Analysis of the Auditor General's report on the Ministry of Health. The actual expenditure in the Ministry of Health has been increasing annually from 28 billion shillings in the financial year 2013-2014 to 42 billion shillings in the financial year 2015-2016. The ministry's average share is 3.7% of the total government budget. This is well below the recommended Abuja declaration of at least 15% of the total budget. Every year, the Auditor General has the constitutional and legal mandate to examine financial statements of all public institutions in order to determine whether public money has been spent lawfully and effectively. The Ministry of Health was awarded an adverse opinion in the financial year 2013-2014. An adverse opinion implies that the financial records do not present a true and fair view of the financial position for the ministry. In short, this was a bad review. In the following consecutive years under review, the ministry was awarded qualified opinions. This means that the Auditor General gave the ministry a positive review, but there still exists a few issues that can be easily rectified. Trends in total queried amounts. Queried amount refers to money that the Auditor General identifies as money or transactions that have been made unlawfully. In the first year under review, the total amount of money queried was 17 billion shillings. This accounted for 63% of the total budget for the ministry. In the second year under review, the total amount of money queried was 14 billion shillings. This accounted for 36% of the total budget for the ministry. And finally, in the third year under review, the total amount of money queried was 18 billion shillings, accounting for 42% of the total budget for the ministry. In the financial year 2013-2014, the queries raised by the Auditor General were mainly failure to reconcile books of accounts, lack of supporting documents, and violation of financial regulations. In the financial year 2014-2015, the queries raised by the Auditor General were mainly violations of financial regulations, failure to reconcile books of account, and no value for money. In the financial year 2015-2016, the queries raised by the Auditor General were mainly on lack of supporting documents, long outstanding balances, and violation of financial regulations. Opportunity costs. The Auditor General's report points out various instances of projects that were not successfully completed and thus directly inhibiting the social benefits that would have accrued to the youth and general populations. For example, expenditure on non-existent consultancy services. In the financial year 2013-2014, the ministry spent 34 million shillings on consultancy services for the reinforcement of 15 health facilities in northern Kenya. Audit findings revealed that expenditure was made without delivery of services. If this money was properly accounted for, then 34 million shillings would have been adequate to procure 42,500 special insecticide-treated mosquito nets for the prevention of malaria, a leading cause of deaths in Kenya. Another example of stalled projects is the proposed upgrading of Othaya District Hospital Phase 1. Audit findings reveal that in this project, 230 million shillings could not be properly accounted for. Nyeri County, for example, experiences high reported cases of respiratory diseases. A common antibiotic drug for treatment of this is amoxicillin. 230 million shillings would have been adequate to stock the county hospitals with approximately 4.6 million units of amoxicillin drugs. In another instance, the government awarded a contract to an investments company in 2015 to supply 100 portable clinics at a total cost of 1 billion shillings. Unfortunately, 800 million shillings was paid, representing 80% of the total budget for the portable clinics before they were installed, commissioned, and handed over. Hence, no value for money was obtained for this project.